I am Dr. Aloy Majumdar from Chandra Super Specialty Eye Hospital, Lucknow. I am a retina surgeon and today I'll be talking of diabetic retinopathy. A small bit of information for you for daily implementing and awareness. Now, India is the diabetic capital of the world. We have got the maximum number of diabetics in the whole world. And simultaneously, we have the highest number of diabetic retinopathy patients as well. So the problem statement is huge. Ignorance, unawareness, and our Indian ability to bear with deficits have caused a major problem. We have a lot of diabetic retinopathy both in villages as well as in cities. As a matter of fact, they found that the rural population was more affected because the reach of treatment and appropriate management was not there. So the patients were more critical and lost vision more as compared to the urban patients who had a better treatment facility. Now, the primary problem with Indian diabetics is fat management. It is not only about sugar, tea, coffee, etc., or potatoes or rice as a matter of fact that most of us think of when we think of diabetes. It is actually fat management. We Indians bear a gene called as thrifty gene, which makes us more prone to being diabetics and thus more prone to develop the retinopathy, that is the complication of diabetes. Retinopathy is a microvascular complication of diabetes, and that means the diabetes affects the small blood vessels of the retina, causing their clogging, breakage of the blood vessels and bleeding in the retina. Initially, they present as small retinal bleeds, that is hemorrhages, and small outpouching in the vessels of the blood vessels, that is microaneurysms, and then these vessels bleed as dot and blot hemorrhages. Later, this exudation leads to formation of the swelling in the retina as called as clinically significant macular edema or central macular edema, and later this may also lead to development of new blood vessels both in the posterior part of the retina as well as elsewhere in the retina, including the nerve of the eye. Diabetes is a major concern because this is a major cause of blindness in young and adult population in India. Very important reason of diabetes being ignored is non-treatment and ignoring the fact that we have diabetes. We try all other pathies instead of appropriate clinical management. To avoid it, we go to extents that are not recommended. When the diabetic retinopathy progresses, the blood vessels in the retina, the major blood vessels, may even break and cause hemorrhage in the eye, which may need further surgeries and a poor visual outcome. Treatment modalities in the early phase are many. We can go for injections to reduce the swelling in the retina and restore good vision in the retina. Besides, if we need, we can also give laser treatment both in the back of the retina and in the elsewhere of the retina, which can reduce the exudation or sumpiness in the retina or the swelling in the retina. Surgery is rarely required in only 1% of diabetics, which clears the blood in the retina, also the fibers that form on the top of the retina, and that restores the vision to a major extent. But diabetes is an ongoing process. We should always remember diabetic retinopathy is not treated by ophthalmologist alone or a retina surgeon alone. The primary care physician or the diabetologist has the most important role to play in your diabetes. Keep your diabetes well controlled and well maintained within the recommended levels. Keep your hemoglobin A1C somewhere between 6.5 and 7, and your diabetic retinopathy will be at bay for a very, very long time. Thank you.